My name is Averill Fuhs. I'm a family medicine physician that's joining the Spirit Lake practice. I grew up in Sheraton, Iowa, which is a small town about an hour south of Des Moines. Went on to my undergraduate at Drake University, then went on to Des Moines University for medical school, and I have done my residency training in Davenport, Iowa, and I'll be joining up in August. I'm married. My wife works at Parks Marina. I've got family scattered kind of all over the place. I don't have any kids or anything, but I've got 3 sisters. My parents are still in Iowa. My wife's family is still in the state of Iowa for the most part too. The attraction to medicine was always about getting to know the people. The way that I got there is a little funny. When I was a kid, I was really interested in fish and marine life and things like that. I was good at science, I was good at math, it kind of went together. So one day when I was at one of my well child visits, my doctor asked me, what do you want to do when you grow up? And I said, I wanted to be a marine biologist. And he laughed at me. He said, we're in the middle of the United States. There's not an ocean anywhere even close to here. If you like science, then you should go into medicine. And I was like, oh, okay, so I'll try that. And it ended up being fantastic because it was exactly what, I didn't know it at the time, but it was what I needed, which was getting to know people. Got to know a couple more things about it, spent some time in the clinics down where I'm from, and really found out that was a place for me. Getting to know the people that I get to know now and working with the people that I work with now has really been a really satisfying thing. What I love about family medicine is I get to take care of people of all ages. Grandma in the nursing home or newborn babies, pregnant women, well child care, adult visits, anything in between, doesn't matter. There's not anybody that will come to my clinic and I'll say, I can't see you here. There's always something that I can try to offer to somebody, and that's really what the draw was for me. The attractive part about Lakes Regional Healthcare, first of all, was the people that I met on the interviews that I did. I took my time and I got to know a lot of the people that I met on my interviews. I got to know a lot of people from the community, and the individuals that work there is really what was the draw for me. So my colleagues or my partners that I'll be working with in the clinic were a huge draw, and the staff around them was the other big draw. Facilities are a great thing, and they're redoing their facilities right now, so that's going to be a nice perk, but the bottom line is the people there was what attracted me to that place. Part of my job is to prepare people to take on the biggest challenges that they will see in their medical life. And things like that here in the United States, first and foremost, is like cardiovascular disease, metabolic disease. Down the road, there's also cancer screenings and things like that. So probably the biggest piece of information I can give people is to really pay attention to the things that you eat and how much exercise that you get. The root cause for most cardiovascular issues, whether it's heart attacks, strokes, stents, whatever it might be, if you're not exercising, you're not eating the right things, or if you're smoking, a pack a day of cigarettes, those are things that are going to really be detrimental to your health down the road and cause you more problems than not. So I guess in summary, I'd say eat less, move more, and watch what you eat. Being relatable to patients, in my experience, is something that can really make or break a physician-patient relationship. So if you, as a patient, don't feel like your provider trusts you or listens to what you say, then there's going to be breakdown of that relationship, and you won't have as much trust in me as a provider. And that street goes both ways. I expect truth and trust from my patients just as I would give that to them. So I try to listen to the things that they have to say. Oftentimes, if you listen long enough, eventually someone will tell you what the root cause of the problem is. So listening, I think, is a very important factor, just as it is in everything else in life. If you don't listen, you don't get all the information, you can't make a good informed decision. Well, I get excited about coming to work because I like dealing with people. So, being a physician, it's fantastic because you see all different kinds of people from all different walks of life. So for me, it's getting to know those people, getting to know their circumstances, and trying to offer the best advice that I can based on whatever the circumstances are. Everyone really opens up in front of the doctor, and that's another thing that I like. I like to get to know people at a different level than I would otherwise, and try and give them the best advice that I can and help them out as best as I can. So that's really what it is getting to know the people and caring for the people. That's really what it is for me. My personal hobbies is I love the water, I love being outside, I love biking, running on bike trails, that sort of thing. So all those were offered to me, in Spirit Lake. I've spent time in big cities and really small towns and everywhere in between. It's nice to have certain amenities of a big city, and it's nice to have that small town feel. For me, Spirit Lake offered the best of both worlds. They have enough amenities and things to do that it keeps things exciting, particularly in the summertime. But in the wintertime, things calm down and it really feels like a small town again. It gives me an opportunity to experience all the amenities during the summertime and also get that small town feel in the wintertime.